Just giving the high sign. 1 minute, please.
Can you sing, Stan?
Da, 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 da. I get Tom out here to dance. He's Should I try my joke again?
No. Do you have the service member songs? Okay. We're going to play with this.
Yeah.
We're going to do the service members. Oh, now she's in the show. Oh,
No, that's not her.
And is that her?
No.
Okay. Army! Well, no.
Go ahead.
Yeah, let's do it as long as we're waiting. Yeah.
He was premature with that. All right, let's all the Army people
Okay,
stand as able.
Stand up.
Yeah.
Good. All right. Good. There we go. You always know that the Army is rolling on.
Used to be artillery.
Good.
Navy people. Coast Guard.
Yeah. My dad was. Yeah.
And the baby of our military services, Air Force.
Air power.
And last but not least, U.S. Marine Corps. Hoorah!
All right.
Frank, are we ready? No.
I just got a text that she was. Yeah, we're ready. Yeah. Here. Officer of the day, Frank, could you check that they're ready? We're good to go. Yeah. I didn't say that. Just take Al outside.
Take Al out, period.
We saw that before.
Yeah, that was 20 minutes ago.
Hey, everybody, give a warm DAV welcome to State Senator Leah Vukmir.
Excellent.
And I'll just start things off first.
Okay. Morning, everyone.
Good morning, State Senator.
Good morning.
How we will begin things is the State Senator will give opening remarks, and then I have some prepared questions. And these came down from National Legislative DAV. And then from there, you'll go into closing. So with that, if you give your opening statement.
Very good. Well, good morning, everyone. I am honored to be here. And I thank you not only for the invitation, but I thank you for your service. I am often thanked for my service as a member of the state legislature. And I got to tell you, every time somebody thanks me for my service, I have a hard time taking those words and hearing those words. And I know they mean well, But when I think of service, I think of what all of you have done by wearing the uniform of the United States of America and protecting our liberties and freedoms. I thank you for your service and all that you have done so that we in this great country can put our heads on our pillow at night knowing that we are safe. So to all of you, I say thank you for your service. I am a nurse. I'm still a nurse, working today as a nurse. I've been a nurse my whole life. I'm a military mom. I have 2 children. I have a daughter who is 30. She lives and works in New York City. And I have a son who's 26 who gives me the incredible honor of saying that I'm a military mom. He is a first lieutenant, soon to be a captain in the United States Army in a matter of a few weeks. In March, I had the privilege of going down to Fort Benning and pinning the Ranger tab on his sleeve. And I am very proud of that young man and all who are currently serving. I should tell you a little story about him because it tells you a little bit about who I am and what my commitment is to you, because I look at your service through the eyes of my son who currently serves. He was 10 years old when 9/11 happened, and he was glued to the TV. And when people were suggesting to parents that they ought not let their kids watch the vision of the Twin Towers coming down, I said, no, I will let him watch that. He needs to see this. He was captivated by it, and it truly sparked in him the desire to serve. And it never left him. And through the years, many people would say to me, well, you're going to discourage him, aren't you? And I said, absolutely not. I think it's honorable that he wants to stand up and serve, and that motivated him to see that assault on our country. And he continued to want to serve. And of course, oh, you can't hear? Is there, move him in? Is that better? All right, very good. So he continued to have that desire, and he chose Army. And I'm proud of him. He went through the Army ROTC program at Marquette University. He just recently has been stationed, moved to Fort Myer in Arlington, Virginia, where he is a member of the Old Guard. So I'm excited about his service, but that tells you a little bit about me and why I'm so committed to ensuring and protecting all of the things that you have done for us. So I'm also a daughter of Greek immigrants. My father came to this country in 1954 from Greece, and he came with a penny in his pocket and a dream in his heart. My mom was born here, but her parents were from Greece, so I did grow up in a big fat Greek family. And my father really infused in me a strong sense of patriotism because he came to this country because he was starting to see changes in his country. And I think that also tells you a little bit about me and perhaps why I pass that patriotism on to my children and why my son is serving today. I got into politics out of circumstance. This was never in my cards. I always say I got in out of circumstance, not ambition. I was a mom with a cause, concerned about educational issues in my daughter's classroom. I questioned the role of government. I went to a school board meeting. The next thing I knew, I was going to more school board meetings. I went to the Capitol and testified, and I learned about this amazing civic process. And I had the opportunity to run for the state assembly in 2002 when Scott Walker decided to run for county executive. And that's what started it. So I served in the assembly until 2010, served in the state senate in 2010 until now. And now I have the opportunity and the incredible privilege to stand before you as the GOP nominee for the U.S. Senate. I'm thrilled. I'm honored. I have a philosophy of government which is very simple, and that government should be limited, and that the people closest to the problems are best suited to solve those problems. And I look at things through that lens as a nurse, as a problem solver, because that's what nurses do. We listen, we identify problems, we come up with solutions, we apply the solutions, and if those solutions don't work, we've got to come up with something new, and sometimes we have to do it really fast. I wish government worked as fast as that, but that's the approach that I take, and that's the approach that I would take if you give me the honor of being your next U.S. Senator. And with that, I will turn it over to you.
All right, thank you so much. As you know, Congress recently passed legislation funding the Department of Veterans Affairs for the upcoming year 2019 and advanced funding for 2020. While the funding level will meet most of all VA and veterans' current needs, medical care funding is likely short $1.6 billion for the fiscal year 2019 and $8 billion for the fiscal year 2020. This is the question. What will you do to guarantee VA will receive these funds to ensure veterans receive the medical care they need in a timely manner?
Well, this is a very important issue, and I want you to know that you have my commitment that your care and the needs that you have will be met. And that's why I have been somebody who has fought so hard in Wisconsin to look within and find waste, and there is waste in government. And I don't support big government approaches that will actually mean that there will be fewer resources for you. And that's why I'm so very strongly opposed to plans that will completely turn over our healthcare system right now. There's the plan that is out there for Medicare for All, a single-payer government-run healthcare system that my opponent supports. And I'm being very adamant about explaining this because I think it's important for all of you to know that that program dismantles Medicare, Medicaid, the Affordable Care Act, TRICARE, and all private insurance. I've actually read the bill. And what that says to me, at the tune of a conservative estimate of $32 trillion over 10 years, that means there are going to be fewer resources dedicated specifically to you as veterans. That scares me. That is complete uncertainty in healthcare. I'm a nurse. I want people to have the best access to quality care in a system with doctors who know how to provide that care. And under a system like this, fewer doctors will want to learn to become doctors, will go into the profession. Many of those close to retirement will leave because they don't want to be reimbursed at the lower rates that they will. That means we'll have more people in a system, fewer doctors, and the care will dramatically decrease, and I will fight tooth and nail to make sure that that doesn't happen.
Thank you. DAV, along with 30 other organizations, supported passage of the VA Mission Act of 2018. These new laws are expected to improve access for veterans by creating integrated networks of VA healthcare systems and community partners while maintaining VA as the primary provider and coordinator of care. Although VA has always relied on private community care to fill access gaps, there are still some critics of the VA Mission Act who argue that the law would push VA towards privatization. The question, what do you say to those that believe the VA Mission Act will lead to privatization of the VA healthcare system?
Well, I want you all to know very clearly that I don't believe in privatization of the VA system. I do believe that the VA Mission Act was an important step to help veterans receive timely and quality care, and I think that's what's really important. And by expanding the community care program, the administration increased necessary options. I want to see more options for you, not fewer options. And I think it's one of the examples of when government gets involved, we have these arbitrarily set parameters like 30-day waiting periods and 40-mile radiuses. And I don't think that's necessarily in the best interests of all of you. And I think it's really important that, especially if we're going to take care of all of our veterans and all of their needs, then you need more choices and not fewer choices. So to the extent that it does that, I'm glad for that. We should really look at and focus in on what the VAs are best known for and what they do best. And we know that the VAs do excel in treating mental disorders, PTSD, combat-related injuries, rehabilitating vets with amputations. But a lot of the day-to-day care really could and should be given closer to you where you live in a setting that is much more accessible to you. And to the extent that we can continue to look at our VA from the perspective of focusing in on those issues that we know they do best, but giving you more choices and options for some of the routine care, I'm fully supportive of that.
DAV was instrumental in establishing VA Comprehensive Caregiver Support Program in 2010, which provides family caregivers of veterans severely injured on or after 9/11 with important caregiver support such as education, training, health coverage, and a modest stipend. Because of DAV's work on the Mission Act this past year, family caregivers of all severely injured veterans will be able to participate in this program. However, veterans who need family caregivers due to severe illnesses, due to such things as toxic exposure from Agent Orange and burn pits, or suffering from Persian Gulf War illnesses, are not eligible to participate in the VA Comprehensive Caregiver Support Program. The question: will you work to pass legislation to ensure family caregivers of all severely ill and injured veterans are eligible for VA's Comprehensible Caregiver Support Program?
Absolutely. You know, I've been holding roundtables with veterans across this great state of ours. To date, I've put on 89,000 miles on my car in the last year and a half, and I've been to all 72 counties, most of them more than once. And this is the one issue that I've heard from so many of you on, and I've received emails and letters from you as well. I think it's incredibly important that we look at using this program for exactly what it's meant for. The caregivers program is for people who need that care. And right now, if people are being left out and there isn't that safety net for them, then we have to make sure that it is there. So, you know, the VA definition for injury does not include many other illnesses that you're suffering from where you will need help to do your day-to-day activities. And so I think we need to provide that care to those who deserve it. And if we are falling short in that area, then we need to address it. And I would be committed to doing that because I obviously understand it from the perspective of a nurse. And I know that some of these diseases are complex, and I know that they can cause you a lot of difficulty just doing your day-to-day activities in your homes. And that's not right. And we have to make sure we fix that.
Thank you. The number of women serving on active duty in the National Guard and Reserve components of the military continues to increase rapidly. So do the number of veterans. The total population of women veterans expected to increase at an average rate of about 18,000 women per year for the next 9 years, making the need to ensure sex-specific care and services are available to women when they come to the VA. The question: what would you do to ensure the sex-specific needs of women veterans are addressed appropriately within the Veterans Health Administration?
Well, I think it's exciting that we have more and more women who are serving. And before I answer the question, I will tell you that my son in his Ranger class had a woman who is competing in it with him. And they became very good friends. In fact, in his pre-Rangers class, he said that he called me because he had about 8 hours before his pre-Ranger and his Ranger program began. And he said, "Mom, there is a 35-year-old woman in my class. She's 5'4". She beat me on the PT test by 2 push-ups. She's a tough cookie, and I hope she makes it." And we had a Facebook page for all the parents to keep track of how our kids were doing. And, of course, we couldn't hear from them only in between. You know, there was an 8 to 10 hour period in between each of the 3 phases. But we kept in touch, and if we got a letter from our Ranger student, we would share it. And I got to be very close to this young woman's mom and was very proud to find out that she did pass. She had to do one extra redo of one of the programs. She recycled, but she followed through on that commitment. So this is a serious question. I know these next couple questions relate to women, and I think it is part of your question and what you're asking is achieved and accomplished with the VA Mission Act by expanding the community care program. It allows women to see clinics that are equipped and capable of handling the day-to-day problems and care. But we do need to provide the VA with the tools that are necessary for all veterans. And I'm proud that women are stepping up. And because of that, this is a new need that must be addressed. And certainly, as somebody who has served as a woman nurse, taking care of women, men, children, it's important that we have specialized care. And the care will be more specialized in this case, and we need to move forward in that direction.
In September 2018, the DAV released their report, Women Veterans, The Journey Ahead. It spotlights how the expanding role of women in our armed forces is necessitating change to an array of policies and programs in the Department of Veterans Affairs and other federal agencies. Women are the fastest growing subpopulation of the military and the veterans community, representing more than 15% of active duty military and 10% of veterans. Yet, despite recent progress, some women veterans continue to face significant barriers accessing health care and other earned benefits and do not receive proper recognition for their service to the nation. Nevertheless, despite these ongoing challenges, Congress has not had a hearing on female veterans issues since December 2015. Question: do you support calling for a new oversight hearing to discuss these issues? And can we have your commitment to help resolve these issues moving forward?
An easy answer, yes. And in fact, in Wisconsin, I'm proud of what we have done for our women veterans as well. And one of the things that was in our most recent budget, and I'm on the Joint Finance Committee for the state legislature, we did put in a study in the most recent budget, a study specifically looking at the needs of our women in the military, and I was proud that we did that. So it'll be something that you'll want to keep an eye on when we get the results of that, but that's our step here at the state level. So obviously if I support that at a state level, I would definitely support that at a federal level, and it's a shame that that hearing has not happened.
In recent years, there has been a number of alarming proposals calling for the reduction of veterans' benefits, whether as part of the VA budget submission, CBO or OMB report, or another source. For example, the administration fiscal year 2019 budget request, our VA contained a proposal to round down the cost of living adjustments for service-connected compensation and dependency and indemnity compensation. This proposal would cost veterans $2.83 billion over 10 years. The question: where do you stand on the issue of scaling back veterans' benefits to reduce government spending? And do we, as disabled veterans, have your assurances that you will stand with us to oppose any such proposals in the future?
Yes, you have my assurance. We will not be making cuts on expenses on your backs. It's wrong. For all that you have done for us, we should not be reducing your care and what you receive in the way of benefits. You know, the federal government has so many excesses, and that's one of the reasons why I'm just itching to get there. You know, I talk to people all across this great state, and they are so frustrated because when they sit around their kitchen tables, they look at the resources that they have, and they say, we live within our means. People in Madison, people in Washington should do the same. And I'm going to take that same sort of approach to Washington, where I know that we can streamline and find ways so that we don't have to affect these benefits and reduce them for you. We've done a good job of going through a lot of the departments in Wisconsin. And you have to have the will, and you have to have people who are willing to say enough is enough. And I am one of those people who have done that here in Wisconsin, and I want to do the same in Washington.
Large burn pits have been used throughout the operations in Iraq, Afghanistan, and Djibouti, Africa, to dispose of nearly all forms of waste. It is estimated that such pits, some nearly as large as 20 acres, are or have been located at every military forward operating base. The burned waste products include, but not are limited to, plastic, rubber, chemical, such as paint solvents, petroleum products, munitions, and other unexploded ordnance, wood, waste, medical and human waste, and incomplete combustion byproducts. Today, thousands of veterans believe their illnesses are due to their exposure to burn pits, but the government offers no presumption these diseases are linked to burn pit exposure. The question: do you believe that our nation has a responsibility for investigating and compensating veterans for any negative health impacted by burn pit exposure?
Absolutely. If we are putting our young men and women in positions that are exposing them to unnecessary risks, then it is our responsibility to investigate them and find out the extent to which they are affecting them medically, and what are we going to do to help them. If it is indeed determined, and it'd be pretty hard for me to believe that it wouldn't be given all the things that are in these burn pits, if it is causing our veterans to live with long-lasting diseases, then we absolutely have to have a serious discussion about what is going on there. And I think that is just a simple matter of will and determination and priorities. I have said all along that you all must be a priority for us. And that is why I would most definitely would want that investigation.
Medicinal cannabis policy at the state level has shifted significantly in recent years as states have moved to legalize the drug for both medicinal and adult use, which often run counter to federal marijuana policies. One such policy area is in conducting robust, effective medicinal cannabis research. Current policy prevents the Department of Veterans Affairs from conducting comprehensive clinical studies of cannabis to prove medical safety and efficiency for veterans who receive health care from the Department of Veterans Affairs. The question: what is your position on the VA conducting research on cannabis-derived products, and their delivery system?
Well, I know this is an issue that comes up quite a bit. I have been on the task force, the governor's task force on heroin and opioid addiction problems, which, as you all know, is a huge epidemic, not only in our state, but across the country. And one of the things that we did is we listened to people all across the state. We brought in people from across the country who are leading experts on this issue, and what are alternatives for pain management for people with who are having all kinds of different conditions. And I was pleased, because I did go visit the Toma VA recently, to see that they are implementing many of those alternatives, and there are quite a few of those pain relieving solutions. Chiropractic care is included, cognitive behavioral therapy, and the list goes on. And not one of the things that we talked about during the task force included cannabis. It is a Schedule I drug, and I feel strongly about the entire process of how we handle looking at drugs and the process that they must go through. And it is an FDA approval process. And so if there are going to be any changes to where it falls on the schedule of drugs, then I believe it needs to go through that process.
In May 2017, the administration's fiscal year FY 2018 budget contained a proposal to eliminate eligibility for total disability based on individually unemployment, commonly referred to as IU. For thousands of disabled veterans, it would have terminated existing IU ratings for veterans when they reach the age of 62, as well as cut off any veteran already in receipt of Social Security retirement benefits. DAV and other veteran service organizations, in opposition to the proposal, reminded the administration that TDIU is not equal to or similar to unemployment insurance or a retirement program. The administration subsequently backed away from this proposal. However, the threat remains that this proposal, or something like it, could resurface in the future. The question: where do you stand on the issue, and do we as disabled veterans have your assurances that you will stand with us to oppose any such proposal in the future?
You have my word. We have to protect these options for you. If I'm committed to taking care of veterans, in particular disabled veterans, you know, I, as a nurse, have taken care of disabled children, and one of my special projects in the state legislature was to ensure that we had a special needs voucher program to educate children differently. So I don't look at disabled veterans any differently. You need to have those special programs, and they need to be continued. And I think one of the things that we can do as a way to do it is that, you know, government right now offers so many programs and services that overlap. And we need to have somebody go in there with a common sense approach and say, if this is overlapping, think of the waste of money that is going on there. Let's consolidate these services so we don't have to make these changes that would affect you.
As you may know, veteran service organizations are here to not only provide the perspective of the veteran, but also to guard and protect the benefits and services earned by veterans, including protecting the VA from privatization. Question: would you be willing to work with veteran service organizations and other stakeholders not only to ensure veterans' benefits, services, and health care are safe from privatization, but also to work to ensure that VA has all of the resources it needs to provide optimal health care while effectively administering the benefits and service veterans that they have earned?
Absolutely. The answer again is yes. You know, one of the things that I have found in my role as being a lawmaker is that similar to how I would practice in my nursing practice, is that you really have to listen. And in many ways, when we are lawmakers, we're like general practitioners. We have to know a lot about a lot of issues. But the general practitioner also knows when they need to refer to a specialist. And so what happens when you get into the legislature, and I remember thinking this when I first got in, I think, what did I just get myself into? And all of a sudden, people started coming up to me and asking me questions about various bills that were being put forth that had to do with education reform, because that was the issue that motivated me to serve. Or they would ask me questions about health care. And I realized that within my caucus, I became an expert, and I was able to help and give guidance in those areas. Likewise, there isn't a farm in my district, in the 5th Senate District in southeastern Wisconsin. A lot of former farmland, but no farms. But we're an agricultural state. I have to make decisions about farming. So I have to seek out experts in my caucus as well. But that information and those experts are not just amongst ourselves. It is organizations like yours. You are experts. And so when any piece of public policy comes before me, and I think it's incumbent upon every lawmaker to do this, you have to bring all the stakeholders in. And that's why your organization is so important, and why you're being at meetings like this, where you have the opportunity to hear about legislative updates, and then it gives you the motivation to talk to your lawmakers and tell them, this is how it affects me, because you are an expert on your issues. So you have my word that I will always listen to you on these issues, because it is something that I've done throughout my entire career, and I'm not changing now.
And The final question, H.R. 299, the Blue Water Navy Veterans, the Blue Water Vietnam Veterans Act of 2018 would reverse an erroneous decision by the Department of Veterans Affairs in 2002 that made thousands of Vietnam veterans, commonly called the Blue Water Navy veterans, ineligible for health care and benefits connected to illnesses caused by exposure to Agent Orange. H.R. 299 passed the House of Representatives in July 2018 by a 382-0 vote. It's currently being considered by the Senate. Question: do you support expanding presumptive disease to those veterans who served in waters offshore of Vietnam?
Yes, to me this is a no-brainer, absolutely. And if I am in the Senate, you have my word on that. That was an easy one.
Thank you so much. And then if you could, ma'am, go into your closing comments.
Absolutely. Well, again, thank you very much for the opportunity to be here. And it's truly an honor to be with all of you. I said it before, but the sacrifices that you have made, your families have made, now I am understanding it from the perspective of the families as well. It is truly a family being a part of the military, and I'm honored to be a part of it. While I have not worn a uniform, I appreciate what you have done. You have a big decision to make in a few weeks, and having the opportunity to be before you is important to me. And I hope that you will look at this upcoming election and understand the stark differences and the choices that stand before you. I hope that what you heard when you listened to me today is that I'm a person who loves to solve problems, and I look at government and solving problems in government very differently than my opponent does. I don't believe in big government solutions. I believe in solutions that are made closer to home in the states. And look what we've done here in Wisconsin. Wisconsin is considered one of the best states for veterans and veteran benefits. And that's because you have a commitment from the leaders here in Wisconsin. And in large part, it's because you've been a large voice to tell us what are the things that you need. And so that is one big stark difference. When I think about big government programs, I talked about it earlier, a complete takeover of health care by the federal government is a wrong direction. And I fear greatly that all people will have far worse coverage and care than they're currently getting. And I want to just clear one thing up, because a lot of people ask me about this, because there's a lot flying around in the news about pre-existing conditions. And I said it very strongly. I support coverage for pre-existing conditions. And you have my word that I will continue to support it. So I hope that that isn't an issue that you're going to question from here on out. In fact, I'm more concerned about a complete government takeover of health care and what effect that will have on people with pre-existing conditions. I'm also very different on the issue of the Toma VA, and I have to mention that issue because it is an issue that more than anything has motivated me to be in this race. I would never have turned my back on the veterans at the Toma VA. What happened there was wrong. I'm so glad that the Toma VA is doing incredibly well, and that's why I wanted to go in and tour it and see it, and to see how well they have turned it around, and our veterans are receiving alternatives rather than opioids. But it's unconscionable that many of the veterans were on 14 and 15 drugs. I would have jumped in immediately. I would not have waited months until it was uncovered. I would not have fired a staff member and offered them taxpayer hush money to keep the issue quiet. It's wrong. It's not being accountable to you as veterans, and you have my word that I will be accountable to you. Because if someone cannot be accountable to veterans, then they can't be accountable to anyone else. Let me just end by saying Wisconsin needs, and our country needs, strong leaders. Leaders who understand the day-to-day challenges of what families are facing. That's one of the reasons why I stayed in the real world working as a nurse, so that I could hear what those day-to-day challenges are. Day-to-day challenges that I face, as I faced as a mom trying to get 2 kids through college. I think it's important that we have people who understand those issues and are willing to go to Washington and always listen and remember the people back home. I've been a passionate advocate for my patients, and I've taken that advocacy to be passionate towards the people that I've served here in Wisconsin in my Senate district, and I want to take that passion to Washington. You know, we've had a great track record. I mentioned the fact that Wisconsin is a state that veterans have some of the best benefits in from across the country. And one of the things that I'm proud of that we did in our last budget is that we put $9 million to the DVA for vet grant programs. I mentioned one earlier, the study for women. That was a $20,000 program. That was a grant. There was also a $60,000 grant program for crisis intervention and mental health. And we also had $80,000 put towards grants for disabled veterans so that you can have rides to your appointments, to your doctor's appointments, wherever you need to go. That really shows a commitment that we've had here in Wisconsin, and I will take that same commitment to stand with you for the service that you have done for us. Thank you so much for giving me this opportunity. I will be around for a little bit if you have any questions afterwards, but God bless you. God bless this great state of Wisconsin, and God bless America. Take care. Thank you. Thank you.
Thank you so much. Thank you so much. Yeah.